From the Psych Hub Podcast Network, welcome to Coming Back Better, a podcast sponsored by HCA Healthcare and in collaboration with Columbia University Department of Psychiatry.
Welcome back to Coming Back Better, and I'm joined again by my co-host, Marjorie Morrison.
Hi, everybody. Welcome back. Hi, Paul. Always good to spend time with you.
Hey, what are we talking about today?
Telehealth.
Well, how medicine is practiced has changed a lot throughout this pandemic, and that includes telemedicine, which people have really adapted to.
Using this service will actually cut costs, and it helps those who are actually struggling to get to a doctor.
Think of the benefits of being able to see a doctor from your home.
All of a sudden, out of nowhere, pandemic happened, and it became necessary that we had to use a video for our health appointments. Mental health, it completely sped up the development of platforms and the need for online care like overnight. And now we're seeing a lot of people opting for online care that saves time and it's convenience. And I was just actually reading this morning that in mental health, they're finding that people want to come back and be seen in the office. But it is kind of interesting to think about how much things changed in care delivery. I'm going to guess almost all of us have had maybe a video appointment. It's fascinating. And in mental health, it's really cool that you can just be able to say, hey, I'm ready for my session. And the therapist too just can do it from home.
Yeah, I had a really unique experience with this, Marjorie. Back in 2019, I helped to build a telehealth platform. We took our first patient January 2020, having no idea what was coming 3 months down the road.
Wow.
So we had a full team trained and ready to go. And there were so many therapists out there that overnight they had to figure out how to do this. Looking back, we were going to get here anyways. Everything was trending this way. The elements, the pieces were there. It was just having to really accelerate that. And from the experts that I talked to, I can't wait to share with you, there's so many opportunities and ways that we needed to get here anyways, and getting here quicker actually turned out good for folks.
The very beginning of Psych Hub, when it happened, we created a free course for mental health practitioners on here's how to do it via telehealth. And I just remember we were like, at one point, I think we had like over, a few thousand people on just the wait list for it. I mean, it was just that crazy, but you're right. It really just sped up something that was going to happen anyways. Paul, I know you and I both get the pleasure of working with Juliana on these podcasts. And today she's taking a different seat, and she's going to be our lived experience. And she's going to talk to us as a woman who's been using telehealth since the pandemic and her experience with it.
Oh, cool. Well, I can't wait to hear from Juliana about her experience of telehealth.
Hi, my name is Juliana, and during the pandemic, I started using telehealth services. I was a bit hesitant about going into any medical offices for fear of being exposed to the virus. So it was a big relief when my healthcare providers started offering calls or Zoom calls to go through any symptoms I might be having. It also opened my communication with my healthcare provider, and I was more comfortable talking to them about my symptoms and what was going on. My positive experience with telehealth with my physicians actually led me to start thinking about online therapy. I did not start online therapy until after the pandemic, quote unquote, ended. Actually started a couple of months ago. I was having a hard time finding the right therapist for me, and I actually went through 2 different therapists that did not work out. Even though it wasn't a right fit with the first 2 therapists I tried, I had a better idea what I wanted out of therapy, and thankfully, a couple of months ago, I found the right therapist. Now I have my sessions every Thursday over Zoom, and I am glad I did not give up on finding the right therapist for myself.
Well, Juliana, one, thanks for bringing your voice into our podcast and sharing your experience. The part that really touched me was this idea of a good fit with the therapist, because we all know that's what the research shows, that I really need to feel comfortable and safe with a therapist. And Juliana, your experience was so similar to so many other people that suddenly with telehealth, the number of therapists you can reach out to expanded. And so hopefully that fit thing gets even better when you have telehealth as a way to make this connection.
Yeah, I agree. I mean, she had a positive experience because she was open to communicating, but it might be harder to use telehealth if you're older or you're not as tech savvy or it's hard for you to express yourself verbally. It really can help you connect with the right therapist. I also think it's important to think about when you're doing therapy as I'm a therapist and I used to be in private practice. You really only see your client of how they present when they're in the office that day. But it's kind of cool when you get to see them at home and see their environment and maybe see the kids pop by or something like that. It does kind of give you more insight into all of that too.
It does, yeah. It gets the chance to see folks in another way. So, Noah, I've talked about is our son on the autism spectrum. And, getting him to a doctor's office is not the easiest thing to do. And we've had a couple times where it's like 10 o'clock at night and he has, symptoms show up or a sore or something. It's like, I do not want to go to urgent care right now. And we've done telehealth on the phone and it's been so much easier so that, yeah, for some folks, this has made life easier to get the medical care or the therapy they needed.
And he's okay with it.
Well, okay is a pretty strong term. It's much easier to make it work through my phone on the camera than it is to drive somewhere.
So, Paul, tell us, I know you've spent some time really thinking about these different experts, and it sounds like you had an interesting conversation.
Marjorie, I had a chance to talk to one of our previous experts again, Dr. John Mann. He was in the episode on technology and AI, and he also was fascinating to talk to about telehealth. Dr. John Mann is trained in psychiatry and internal medicine and has a doctorate in neurochemistry. And he was able to really offer an interesting perspective about telehealth, where it's been, where we're at, and where we're heading to. Well, Dr. Mann, welcome. It's a pleasure to talk with you today on this topic of telehealth. Curious to get your expertise and your knowledge and experience on, I'm just thinking the past 3 years, telehealth has significantly changed and love to explore that with you. And I wonder what's your general sort of impressions of telehealth today? Kind of like what's the status of telehealth?
So there's no doubt that COVID had a dramatic effect on healthcare delivery in the United States. And certainly healthcare in the mental health field was immensely impacted. One of the effects of telehealth was to try and adapt to two things. First was that it was unsafe to meet with people face to face. The second was the huge increase in demand for mental health services. There was a very big increase in people requiring help with a variety of psychiatric disorders, including anxiety disorders, depression, PTSD, and various other things, including areas that aren't necessarily formal parts of major psychiatric syndromes, but popular terms like burnout, which was a huge problem in many sectors, but particularly the healthcare sector, healthcare workers. And young people were forced to stay home, to Zoom school. Demand went through the roof, and the method for delivering healthcare had to change. And these were two enormous drivers in the growth of telehealth.
How did telehealth step up to meet that need? Did it do so?
It was impossible in that short period of time to suddenly produce a new pipeline supply of healthcare workers,
right,
psychotherapists, psychiatrists, social workers, all the sorts of people that might be involved in meeting a very big uptick in demand for healthcare, particularly in the mental health sphere. So this basically boiled down to the same people that were available at the beginning of the COVID epidemic, basically increasing their workload, which most people did substantially. The other crucial thing that people don't appreciate is that we have a highly fragmented healthcare system, which is essentially managed at the local or at least the state level, but not at the federal level. As a result, when people have, for example, medical licenses, you're not supposed to prescribe medication across state lines. If you don't have a medical license in another state, then you're not supposed to prescribe medications. But because of the urgency of the situation and the unevenness of the distribution of healthcare workers across the country, and the fact that the pandemic moved from one part of the country to another part of the country, we needed to change the way we did things. And the federal government introduced emergency legislation, which incidentally is still in place, but due to expire in May of this year, 2023, allowing people to offer healthcare all over the country without a medical license in every state and to prescribe in every state. But this was like a huge factor in terms of allowing greater flexibility of healthcare resources so that they could become available across the country related to local need levels rather than to local resource levels. That was a fundamental change in the way healthcare has been delivered in the US, and that was a crucial factor in the mental health care response.
You talked about the change in state lines, being able to practice across state lines to meet the demand. Were there other changes that the COVID and lockdown impacted telehealth, that went from kind of its infancy to being done differently in some ways?
Companies like Zoom and other companies vastly improved their product, and people learned how to use the software. So you ended up getting better encryption, end-to-end encryption, in order to improve the privacy of these methods. Up to that time, there were only very small portals that were restricted to large hospital-based practices that people could use. They were very clunky. Patients didn't like it. Doctors couldn't figure out how to use it efficiently. It was a mess. But as companies like WebEx and Zoom upped their game and improved their software enormously, you could have confidential, high-quality telehealth connections for working very easily. And so that evolved in an accelerated fashion through the COVID era. So most people adapted and just got way better at using these strategies.
What was the general response of the public to this quick pivot from driving to the therapist office to now doing it online? The technology got better. Is there any data we have now about what's people's comfort with it and being okay with it?
Even today, many of us are seeing most of our patients by telehealth, by Zoom. People found it incredibly convenient to sit at home and just get online with their doctor and talk to their doctor. They don't have to go to the medical center, park, find parking. It's just so convenient for them. They're never late. They don't have to be late. Jump on the call, tell the story, back and forth, plan, and it's done. And, we sit there with the electronic health record. We're writing the prescription that goes by email instantly to the pharmacy. It's incredibly convenient. A lot of pharmacies increasingly just deliver the pills. There are people who prefer to be seen in person. They like the three-dimensional contact. But in my experience, that is maybe less than 10%.
I also had the opportunity to talk with Dr. Cabaniss. Dr. Cabaniss is a professor of clinical psychiatry at Columbia University, where she works in psychiatry residency training. She specializes in psychotherapy education and has written several textbooks for trainees, and she also sees patients in Manhattan. And I'd like to welcome Dr. Cabaniss today to talk on the topic of telehealth.
Thank you, Paul. Thank you for having me.
All right. And you have such a depth of experience. And I'm really curious, recognizing how there was such a shift during COVID with the usage of telehealth. Can you share in general, what are some of the positives that have been recognized, and what are some of the challenges or even downsides of using telehealth for therapy?
The positives in terms of access, it's enormous. Telehealth has been used for quite a while. Particularly, it even started with the phone.
Okay.
But most people didn't have the ready access to telehealth the way they do now. I mean, in March of 2020, the whole field just shifted on a dime. And, within a few weeks, everybody was on something. The idea that people who live in places where they don't have access to therapy and or psychiatry, people who can't come into an office because they're not well, they have a newborn, they're doing elder care, they have work situation where they really need to be seen in part of their work day. They work at night and need to sleep during the day. I mean, the idea that these people now have access is just, when you say the pros, it just can't be overestimated. It's huge. So the idea that telehealth is expanding access to so many people is great. Some of the challenges and I'd like to underscore in terms of what we're talking about, is that even though there's a lot more access, there's still not access to everybody. So I think one of the biggest challenges is that just saying, well, now you can see a therapist on Zoom. There are a lot of people who don't have good broadband. One of the things that wasn't done in this country years ago was really ensuring that everybody had the right to good broadband. That was not done. And it means that now a lot of people can just hop on Zoom, as we say, and see a therapist, but not everybody. Phones offer more access, but not everybody has a phone. Not everybody has privacy. It's easy to say, well, you should find a private space. And I always tell the story of when I was in college and I was teaching violin lessons in a public school. And I said to my students, you need to practice in a private space. And I asked them, and one was the only private space in his dwelling was in the stairwell of his apartment building. Right. And it really did drive home to me that people don't necessarily have privacy.
Yeah, and a stairwell is probably not a good place to do therapy, I imagine.
No, it certainly isn't. People were phoning in from cars. A lot of people live in crowded spaces and share their spaces. So that's important. Telehealth still has expense. There's still the issue that just because it's telehealth doesn't mean it's free. People in the field, I'm sure you're in the field, are so in demand that there just aren't enough mental health providers, particularly for children, to go around. So even with telehealth and even with the access, there's still tremendous challenges to get everybody access to the care they need.
So access has gotten better, but we still have a ways to go to get over some further hurdles, it sounds like.
Big access problems. And in terms of creating more mental health professionals, the number that we actually need, these are all hurdles to getting access to all.
So during COVID, I know that the significant shift to telehealth, but now there is more in-office therapy available. And if somebody has the choice whether to do telehealth or in-office, what are some considerations to guide that decision?
Yeah, it's a great question. And again, I think we're both underscoring that if you have the choice, that's a great luxury. Right. So that I want to precede my comments with that because not everybody's going to have that choice.
Appreciate that. Yeah.
Think about if you have the opportunity to sit with a friend or talk on the phone with that friend. If it's night and you just need to talk to that friend and the phone will do. There's nothing like sitting with another person. First of all, that gives you privacy. It takes therapy out of your everyday life, right? So you're not just sitting at your desk and you've been paying bills or you've been doing your work and then there's therapy, right? It really moves you to a separate space where you might be able to reflect in a different way and takes you out of your life for a moment. Again, if you don't have that, then it's better to get therapy in the way that you can, but it is a different experience. And again, think about what you might do with that friend if you were just sitting together talking versus being on the telephone. Maybe you're just sitting quietly for a little while. Maybe you're both observing the pretty day or something like that. I think that there's a difference about being in person. It's still a little bit inchoate for me. I think for myself, for example, one thing I've noticed as a therapist is that I think I can sit quietly for a longer time with somebody sitting with me in person than I can over Zoom. Sometimes when you're on a telehealth call and you don't speak, you almost wonder like if you've frozen or something has happened, right? Is the person still there? But one of the things that's important in many different kinds of therapy is to offer the person who's come for therapy a moment for reflection and not just keep filling in spaces. And I think that I've noticed now that I'm back in the office that I can do that more. And it often offers the person just that extra beat that they need to say something themselves. I can also see our pictures on Zoom are pretty good, but they're not 3D and they don't give you full what's happening. Like right now I'm moving my hands, but you don't know that I'm moving my hands because you can't see them.
Right.
They're expressions, they're ways that people freeze up with their bodies. There are different kinds of nonverbal cues that even if it's somebody say shaking their foot or something, that you just
some
can't
virtual.
see when you're on Zoom. Now, the telehealth options may get better and better as we get into who knows what, holograms or different kinds of things. So much of what we're doing in therapy is really trying to tap into people's emotion experiences. And we can get some of it over the phone. We can get some of it over Zoom, but maybe we can't get all of it when we're not in person. But that said, the advantage to having any kind of treatment, whether it's on the phone, so overrides the other that I would just, for listeners, I would encourage them not to think, oh, gee, I can't go into the office, so I shouldn't get treatment. If the treatment that you can get is virtual, please try to get phone, get Zoom, whatever it is. I really want to underscore my comments as saying we're really talking about access being the number one concern.
Well, and you get me wondering about, there are differences that need to be acknowledged. And I would hope that the therapist had some training in those differences, but just in case, are there some things that we'd want to encourage the clients or patients to bring up with the therapist when they're starting out to try to overcome some of the impacts of the technology? Does that make sense?
It does. And, the training, of course, in March of 2020, there were a whole lot of people doing therapy on telehealth who did not have training.
Exactly.
Right?
Yeah.
So many of us got the on-the-job training because we needed to.
Right.
Now, in most training programs, people are actually getting training and they're being trained in how to do telehealth and what might be different. So, for example, with all therapy, one of the first things that you want to do is set the frame. If somebody comes in, you say, we're going to be meeting once a week and we'll be meeting for half an hour. And I'd like you to say this, and this is what you can expect from me. And you just have to think about that in terms of the telehealth frame. Asking somebody, well, this is from the therapist, but I think the person who comes for therapy should think about this too. Where are you going to be taking the call? And is it a private space? And are there other people in your surrounds? And is there a way that you could minimize them hearing or you're hearing what's going on with them? I think these are things that both the therapist and the person who's coming for therapy should really think about. If it's phone, that's one thing. If it's something that involves a visual, I'd really encourage people to try to maximize eye contact. We're doing this conversation, and with our technology, we can't make full eye contact. Eye contact it's incredibly important when you think about caregiver baby eye contact, that's sort of like the essence.
Right.
If you're sort of always looking at somebody and they're kind of looking the other way, try to keep your camera as close to the photo or the picture of the other person as possible. And I would say that for the therapist and for the person who's coming in for therapy. So if you're going to be using, this is really concrete stuff, but if you're going to be using a phone or a tablet, remember that most tablets are rectangular. Their camera is on the left or right side. So if you're really looking often, very often I'll get onto a call and say, are you on a tablet? I'll say, make it vertical so that you, and the same is true of a phone, right? So that you at least have a fighting chance of getting some eye contact.
Exactly.
So that's really very, very important. The same things for so many other things. Try not to be backlit so that you can really see, because now we're getting in, you really want to see the crinkles in somebody's eyes so that you can tell if they're smiling or if they're starting to have a little bit of a tear in their eye. You really want to be able to see these things. They're terribly, terribly important when we're talking about very emotional topics that people are going to be talking about in therapy. And trying to put headphones on. A lot of people say, well, there's nobody around, but if you can have access to headphones, and some kind of headphone can be purchased quite inexpensively, at least gives you a little bit more privacy in terms of what's happening, and it's not broadcasting into your environment. We often, when we have meetings, blur our background. But when we blur our background, very often parts of our head get lost, right? That's a very odd thing to happen if you're a therapist, or if you're somebody coming for therapy. So you might think, is there some way that you could just put a background? If you really are concerned, I would say to therapists, if you're concerned about what's behind you, invest in a small blank screen or something like that. So rather than blurring your background, again, these are small things, but they make a difference, because what we're really trying to do is create a connection and feel that we're really speaking to one another.
I'm curious your support or guidance for a provider who's still struggling a bit and trying to make this work. Any other guidance for how to make this a useful, effective way of doing therapy?
Just like so many other things, there are going to be people who don't like telehealth.
Good point. Yeah.
And they don't want to do it. And there are going to be some people who love doing telehealth, and they're going to do it all the time.
Okay.
So I think that people are already sorting themselves out a little bit, because I can only hope that both going forward are going to be available.
Okay.
We need everything. Yeah. We need in-person treatment. We need telehealth for people who need access.
True.
So some people are going to really like this modality. And I would also say to therapists, you don't have to use this modality. Just as you might refer them for something else that maybe you don't offer, you might know the people in your community who really like doing distance treatments, and you might refer them. So I think that that's important too. I'm such a fan of supervision of all sorts. If you're already somebody in the field and you're working and you're trying to just get better at this, you might seek out some supervision. And that doesn't, that could be peer supervision. I think we can crowdsource this to some extent. If you have 4 people in your small community who are doing therapy, find a time, and now you can do it on Zoom if you like.
True.
Once every couple of weeks to share best practices, to say, I've learned this, I'm using a new platform, you might try this, that kind of thing, so that you're learning from others and also sharing. The likelihood is that if a therapist is having some kind of difficulty, others are having that difficulty as well. You can share that and learn.
Well, Dr. Cabaniss, this has been such a pleasure. And I'm wondering, any closing thoughts about telehealth, where we're at and where we need to go to?
I think it's important for us to think that we're going to be doing both going forward. We're not just going to be doing one. We're so used to progress and thinking, oh, well, now this is progress and we're all just going to go to telehealth. I think there's going to be room for everything. There's so much mental health need now in our culture, in our society, in our world, that I hope we have both. And I also think that it's important for people who come to therapy to feel empowered to try to get the maximal fit, whether they're seeing somebody in person or whether they're on telehealth, right? So that if you get assigned, if it's a free clinic or if it's a telehealth situation, and somehow you don't feel comfortable with your therapist, allow yourself, I would say, as the person coming to therapy, to trust your gut and to say to whether it's the person who's assigned you in a clinic, whether it's somebody who's assigned you on a telehealth situation, to say, I don't think this is a good fit. I'd really like to try somebody else. So I think that just because you're not seeing the person in person, you should still feel empowered to try to get a situation that makes you feel as comfortable as you can be. And if you don't feel comfortable, you're really always allowed to try to get a better situation for yourself.
Paul, you pretty much already said it as well. It's like telehealth was a response to the demand in mental health services.
Yeah.
We couldn't meet in person and everything changed. Something positive is that it meant that professionals, or what we call practitioners, can increase their workload to meet the demand. We were really able to also see people across licensure. So in each state, you're licensed for your state. Like, I'm a licensed practitioner in California, but if you're licensed in, say, Kentucky, but not Tennessee, and even if you lived by the border, you wouldn't be able to see people there. And all of that was kind of lifted. And so that was really, really cool. And then you see companies like Zoom just come out of nowhere. I mean, I don't think all of us knew what Zoom was, but I don't think there's anybody now today that doesn't know what Zoom is, right? And it's convenient for both the client, the patient, and the provider.
I remember talking to a psychiatrist about telehealth before, and she was saying that finally mental health is in the forefront. It's been in the wings for so long, which is great. But then how do we meet this demand? There's just not enough practitioners to go around. And how Dr. Mann was talking about not only did more people say, yes, I want to get treatment, but how telehealth allowed us practitioners to rise up to meet that demand. And we have a ways to go. Like you said, the technology side, then companies had to step up to be able to provide us a safe, private way to do that. And so there's wonderful convergence. Again, we were going to get here anyways, and I think it gave us a glimpse into what we could do. And then all the regulatory piece, like you said as well, that COVID made us look at what was possible. I know there's some concern that some of these federal emergency regulations are going to expire this year. And we can't lose the ground that we've gained. And so in some ways, I think both patients and practitioners need to stand up and say, no, this is good. And we can't let ourselves slide back. We've got to keep these gains and even expand it more.
What do you think about, though, that like now we're seeing people wanting to come back to the office? Like, do you see a benefit of both? Is it all or nothing?
I hear a lot of folks doing a hybrid approach where maybe for the assessment is in office, where you can get the benefit of this sit across from someone and pick up on all the nonverbals, but then the convenience, because we know the dropout rates in therapy are still quite high. And so if we can leverage the convenience factor, that maybe there'll be more stickiness to continue on with care that otherwise we wouldn't have. So I think, again, creativity and flexibility is what may be called for here.
I'd love to hear about this next guest.
So we have another returning expert, Dr. Christina Lin, and she's with HCA Healthcare, and she's going to share her thoughts about telehealth. And remembering that she is a psychiatrist at Grand Strand Regional Medical Center in Myrtle Beach, South Carolina. And she talked about how telehealth has impacted her practice and her patients.
Let's take a listen.
Dr. Lin, so good to have you here and talking about this topic of telehealth, which our world changed in a heartbeat a few years ago, and now telehealth is everywhere. I do think one of the first questions that people haven't actually done it is, how does telehealth compare to showing up to an office for in-person care?
It is very different. We have done everything we can using telehealth platforms to have waiting rooms and providers that come get you so that it feels like an in-person visit, but it is still through a screen, and it is not human-to-human contact. You have to be willing to be very open and honest through a computer screen, and that can be difficult, especially when you're meeting somebody for the first time. In-person care, there's a lot of behavioral cues that we see in body language that is not in a telehealth, because you get a picture of a head and you're not getting the hand motions or the fidgetiness.
Interesting.
So it really depends on your level of comfort. I think the younger generation has responded to it a whole lot better because they are social media, internet fanatics. The older generation has had a much, much more difficult time getting into it. And I'll say the same about physicians. The younger physicians are jumping on board with it as a lot faster because it's what they're used to and accustomed to. The older physicians are having to transition a little slower into it because they want that in-person care.
It sounds like in some ways there's similarities across the demographics, that whether you are seeking out care, providing it, if you're younger, it's a little more familiar. If you're older, maybe not quite as familiar. I'm curious, anything else around the general public's response to telehealth? And also, what are lessons learned that maybe we need to continue to build on?
The general public response, I think, has been positive. With the initiation of telehealth, we have been able to get providers into communities that would have never had providers, especially in the field of psychiatry. There are communities out there that they are 2 and 3 hours away from a psychiatrist. So we've been able to reach people that we would have never reached before. And so in that sense, it has been a phenomenal gain.
That's awesome. Yeah.
The downside is there's a lot of concerns about privacy, about, are you providing adequate care? Is the company and the platform that you're working with actually vetting and qualifying all of these individuals. All of these things, if you're looking for a telehealth company, you need to look at when you go and sign up for one. How well are they credentialing their providers? Are they vetting their providers? How are they checking in with it? What are the fee structures? Things of that nature. I do a little bit of telehealth, but I do it with people in a program so that they're actually coming into a facility. They're seen by a nurse that's sitting with them. And so I get a lot of feedback from the nurse that's sitting with them about their behaviors and things of that nature.
Oh, interesting.
I personally haven't done any telehealth to someone sitting in their home. That is very concerning to me because of privacy issues. Plus, how focused are you?
Okay.
When you're in your home, can you really openly speak if your spouse is in the next room and you don't want them to hear that you're upset at your spouse? So, things of that nature. How open can you be? And that's all dependent on the person.
Okay.
So there's really a lot of good with telehealth, meaning we are reaching people we've never been able to reach and we're getting care to those people. But we also have to be careful going forward that we're getting appropriate and adequate care to those people. And I think for routine checkups, med visits, it's wonderful. But if it's a complex case or something that really needs more of that in-depth time and work, it needs to be brought in. It needs to be in person and in site. And I think that's what we're going to start seeing is more of a hybrid.
Interesting. Yeah.
You might do some on tele and some in person.
Okay.
And I know a lot of providers around this area, the initial visits will be in person. And then after that, they will consider tele options for visits and things of that nature.
What I appreciate both for the provider and for the patient, it's not just click, jump on a platform. It's how do we take these things that are naturally part of a physical space and recreate that? And what I hear you saying is it just doesn't happen. I may need to schedule a session when my partner is outside the house. So I need to really think this through. It doesn't happen automatically.
And where you're going to have that session. I prefer, as a provider, I consider myself on the other end of the spectrum, the older, slower to respond to telehealth. I worry because I really am a behavioralist by nature. I want to see how you're moving, what your hands are doing, what your feet are doing, what's going on. I want to be able to look at the whole person and put it all together.
Sure.
So
okay.
I prefer telehealth with somebody else, at least in the room with me, another provider like a nurse or something of that nature. Some of the newer ones, they're more comfortable with the platforms. And again, the platforms, they are getting better and better. We have waiting rooms, we have privacy locks, you get direct links, things of that nature. But on the other end, you as a consumer must make sure you get to a place that you can speak openly, because as a provider, I can only treat what you tell me. I'm not psychic. I can't reach through the screen and touch you. You have to be very, very open and very willing to be transparent.
Right, yeah.
And if you can't do that, then telehealth is not the option for you. You need to be in person.
So it's going to take some work on both sides to really make this an equivalent quality and experience. Okay.
I don't know that it will ever be an equivalent experience.
Oh, okay.
I think it's an alternative, and I think it can be used when necessary, but I do not think it will ever equal an in-person visit. There is just a lot to looking at somebody in person, and there's a lot of accountability, and there's a lot of things that you tell someone with your body that you don't even realize you're saying. And even with primary care, any type of medicine, it is that way.
So like any other tool, we have to give some thought to how we use it.
Right.
Okay.
It needs to be a tool in our toolbox, not the only tool in our box.
I thought that she was so interesting, right? And, you've mentioned this too, that if you're in person, you get a lot of body language and that you pick up on a lot of those cues. And it's also interesting that the younger generation is more comfortable. I mean, they're just more comfortable with tech anyways, right?
Right.
And also, I thought it was interesting when she talked about how providers are reaching more communities than they have before. And that's huge, right? With health equity and all of those conversations, it's so important that we can get to people that may not have as much access. I can definitely see that the downside could be the concern of privacy. One is that, are you protected when you're online? What's your privacy? And also having a safe place at home or where you are, where you feel comfortable talking. I used to be in private practice and I had an office and I had a white noise machine. You created a safe environment for people, but now if you're doing it online, and how do you tell the spouse and the kids or whoever, just kind of leave me alone or whatnot, give me some space. So I think there's that. But all in all, does really seem like it's been a positive movement. I do think this notion of a hybrid approach is powerful and where we could be going. And even if someone isn't as open to doing telehealth at home, like we talked about, someone can hear the conversations or something like that. The trends are moving in the right direction, that people are comfortable with it and people are doing it.
Yeah, I really appreciate her direct experience, and that, like anything, advantages and disadvantages to it. And we need to figure some things out yet. And I think there's this sense of who's it going to work best for. But also we need to make sure that we do keep options open and that it's not one or the other. And I think that's the beautiful thing, that now that we've had this grand experiment of everyone thrust into telehealth, let's refine it. And even though younger individuals may be more comfortable with it, I think that convenience factor may be enough to win over some folks that are maybe older and less comfortable. It's here to stay. I think that's clear from everyone that we've heard from today. It's here to stay, and we can only make it better at this point.
I would say to all of our listeners today too, is if you haven't tried it, try it. We don't know what we don't know. And if you don't like it, don't do it. I think there is a benefit to it. And it's like all the things we talk about, is that there's a lot of good that's come from COVID and we're coming back better. And telehealth is one of those. May not be perfect. And for all the reasons we talked about, may not be the ideal for everyone, but it really sure has helped with just making things easier and productivity from both sides, from the client and the provider. So
I think the word that jumps out to me is access. And we all know we need the demand outstrips. The demand is outstripping the supply. And if this helps us to balance that out, then we got to leverage it to increase access.
I love it. What another great episode. Thank you, Paul, for sharing time with us today.
Marjorie, I have some sad news. It's our last episode of this season.
What?
But it's an episode I can't wait to do. It's on self-care.
Ooh, I am not very good at that.
Well, good thing we're doing an episode on it then. And so I can't wait for our listeners to come back for this episode on self-care.
Thanks, everyone, for joining us. I hope you all have a good week.
See y'all next week. Thanks, Marjorie. If you'd like to reach us, you can do so at podcast@psychhub.com. To be notified of new episodes, don't forget to like, subscribe, or follow wherever you're listening. And reviews are so helpful, so please do leave one if you can. It will allow others to find us and join along. Coming Back Better is executive produced by Jacob Morrison. It is produced and edited by Juliana Castro. The series was developed in collaboration with Linda Rosenberg, Carla Cantor, and Kristen Watson from Columbia University Department of Psychiatry, and Manisha Shah, Dr. Frank Drummond, and Amy Rushton from HCA Healthcare. Research is assisted by Melissa Leaf. Show artwork was created by Arnella Jangoli and Ashton Smith. Audience strategy is by Alyssa Fackler, Sarah Hale, and Alyssa Yarama. A very special thanks to Andrea Rollback, Trevin Stegall, Evelyn Valentine, Kaylee Sneed, Julie Plummer, Thad Thomas, Paul Kay, and Elizabeth Roosevelt. Coming Back Better is a co-production from Psych Hub and Columbia University Department of Psychiatry and is brought to you by HCA Healthcare. I'm Paul Dager, and my co-host Marjorie Morrison and I thank you for joining us. See you next week.